गुड इवनिंग टू ऑल ऑफ यू। आप सभी को नर्सिंग विद विनोद सर यूट्यूब चैनल में स्वागत है। टुडे विल डिस्कस अबाउट द उड़ीसा SSSC नर्सिंग ऑफिसर प्रोबेबल MCQ विद एक्सप्लेनेशन। टुडे इट विल बी द day 7. Okay, whatever the MCQ today I will discuss you, that is too much important. Okay, or you can say very important. Okay, so before starting of today's session, wishing you all nursing officer aspirant happiness, success and glory. May your holy celebration this year be memorable. And wish you happy Holi to all. So before starting off today's session, you must have to take care yourself against pandemic COVID-19. मेहनत इतनी खामोशी से करो, मेहनत इतनी खामोशी से करो कि सफलता शोर मचा दे। ओके, आज के पॉजिटिव एनर्जी के साथ आज का सेशन शुरुआत करते हैं। टुडे विल डिस्कस अबाउट द इम्पोर्टेंट MCQ. ओके, लेट्स कम बैक टू द टुडे सेशन. Which of the following method in health communication to perform a skill? A options lecture, B option demonstration, C option seminar, D option symposium. Okay, there are four methods are there. Okay, in what kind of health communication so that one can perform a skill? So put your right answer in the chat box. Okay, sir, when did that NM vacancy will come? Till that no such notification has published by government. Once it will come, definitely I will inform you, dear Rai Lakshmi Sahu. Okay, when it will come, definitely I will tell you. Okay, very good. Okay, very good. Okay, Suprabha, Manjari, Shivram, Pushalata, Monalisa, Kamini, Kavita, Hrusikesh, Latika, Jyoti, Snehanjali. Those who have given demonstration, their answer is correct one. Demonstration is a method in which someone will perform the procedure, anything improperly. Okay, answer will be the B option. Very good. Okay, Josovanti, okay, Suprabha, Mudali also given the right answer. Very good evening, dear Pratima. Now we'll come back to next question. The style of leadership that dominates and commands the group. Suppose, okay, this is the one group. Okay, these are the number of individuals, they are belongs to this group. Okay, just imagine this one is the group. Someone will dominate and command the group. Then mean what kind of leadership it is? Whether it is the autocratic leadership, whether it is the democratic leadership, whether it is the situational leadership, whether it is the Laissez-Faire leadership. So what kind of leadership it is? So put your right response in the chat box. I am waiting for your right response. Okay, you all have to remember, in someone will dominate, one individual will dominate each and every individual of the group, and also beside that he or she will also command the group also. So this is known as autocratic leadership style. Very good. Okay, those who have given A option, their answer is correct one. Very good, Mona Lisa. Okay, then after Ayushman, Ayush, very good. Okay, Hrusikesh also given the right answer. You must have to remember this one. Okay, those who have not liked the video, like the video and don't forget to share with your friend also, because everyone will get the benefit. Okay, this is known as autocratic leadership style. False harmful written report is called. False harmful written report is called. A option में libel, B option slander, C option tort, D option felony. So put your right response in the chat box. Put your right response in the chat box. सही आंसर पुट अप करिए. ओके, okay, those who are putting here also A option, their answer is correct one. Very good. Okay, Angel Walls, okay, Josovanti, Asmita, Pushpangini, Kavita, Jyoti. Okay, another one is the Mansi, very good, Shivram, Pratima, Latika. Those who have given libel, that is also known as defamation. The simple meaning of libel is defamation. Okay, so you have to remember this one. Answer would be the A option. Very good. Divya Bharti Ayushman also put that right answer. Very good. Kamini also given the right answer. Now we'll come back to next question. Checking the equipment and supplies periodically is known as item analysis, investigation, inventory, indent. Okay. Suppose a ward in charge. Okay. First, he or she will check the equipment. What are the equipments are available? Like, okay, suppose this one is the ward in charge. Okay, ward in charge is there. Okay, what will happen? BP machine will be there. That is the sphygmomanometer. Okay, sphygmomanometer. Okay, then another pulse oximeter. Okay, another one is the you can go through ECG machine. Okay, ECG machine. Okay, and etc. So what we will say here? Those who are putting inventory, their answer is correct one. Answer would be the inventory. You all have to remember this one. Okay, very good. Okay, very good. Kavita, uske baad, okay, Joswanti. Okay, very good. Okay, here that answer would be the inventory. Now we'll come back to next question. Characteristics of good reporting include A option fact, B option accuracy, C option legibility, D option all of the above. Okay, what is the characteristics of a good reporting? Okay, what is the characteristics of a good reporting? Okay, put your right response here. Okay, what you will say here? Okay, what might be the right answer? Here that answer would be the D. Very good. Okay, Joswanti, Mona Lisa, Suprabha, Osmita, okay, Hrusikesh, Latika, Kavita, Mansi, Lipsa, Sanjukta, Shibram, Ayushman, Kamini, Pushalata, Sangita, Pushangini, Rukuj, Suman, Jyoti, all have given the right answer. Very good. Priyadarshini, Nachiketa. Okay. Now we'll come back to next question. Theory X and theory Y of management was proposed by William Ouchi, Douglas McGregor, C options Mary Follet, D option Frederick Taylor. Okay, who has given the theory X and theory Y of management? So what might be the right answer of this question? What would be the right answer here? Okay, what would be the right answer? Okay, I am waiting for your right response. Okay. Okay, you all have to remember here. Answer would be the Douglas McGregor. Very good. Shivram, okay. Pushalata, Subham, Joswanti, Santoshini. Those who are putting Douglas McGregor, their answer is correct one. Okay, American professor or American management professor. You all have to remember this one. Now we will come back to next question. Scientific management theory was developed by Douglas McGregor, Frederick Taylor, Adam Smith, Max Weber. So what would be the right answer of this question? What would be the right answer of this question? Okay, or if you have not liked the video, like the video and don't forget to share with your friend also. Okay, so what would be the right answer here? Here also answer would be the Frederick Taylor. Scientific management theory was developed by Frederick Taylor. Answer is B option. Okay, scientific management theory was developed by. You all have to remember this one. Frederick Winslow Taylor. ओके, फुल नेम अगर बोला जाएगा तो फ्रीडेरिक विंस्लो टेलर. Okay, that full name will be this one. You all have to remember this one. Okay, now we'll come back to next question. Two-factor theory, that means motivation hygiene theory of management was proposed by Frederick Herzberg, W. Edwards Deming, C option Frederick Taylor, D option Elton Mayo. Two-factor theory developed by developed by. Put your right response in the chat box. Put your right response in the chat box. Okay, you can answer the question of anatomy, physiology, microbiology, nutrition, biochemistry, okay, anything else. But it is very difficult, okay, or it is very technical whenever you will give the answer of the nursing management and administration, nursing research, health economy. So this might take some, okay, mean overall you must have to study, then you can answer. But other subject you can answer, but these subjects are purely theoretical. Okay, here that answer to be the E option. Frederick Herzberg, very good. Okay, you must have to remember this one. Okay, you must have to remember this one. Okay, answer will be the E option. Frederick Herzberg, very good. Now we will come back to next question. Hawthorne experiment were conducted by Edwards Deming, Elton Mayo, Henry Ford. Okay, another one is the R.W. Taylor. So put your right answer in the chat box. Put your right answer in the chat box. Put your right response in the chat box. Okay, who has given the right answer? Okay, Jyoti Traders is asking when that post will come. Till date no such notification dear. Once it will come, definitely I will upload. Okay, here you must have to remember Elton Mayo. Answer will be the Elton Mayo. Okay, you must have to remember this one. Elton Mayo has given the Hawthorne experiment. You all have to remember this one. Okay, have you got it? Answer would be the B option. Now we'll come back to next question. The process of linking each atom of expenditure to its justified purpose is known as cost analysis, cost saving, cost accounting, value analysis. So what would be the right answer of this question? What would be the right answer of this question? Okay, this question or this nursing administration and management is purely theoretical basis. That's why it is need to study the whole question so that you can understand the question and then you can answer easily. Otherwise there will be a topsy-turvy situation you might be faced in the forthcoming nursing officer recruitment examination. Okay, so what will be right answer here? Okay, that is known as cost accounting. Okay, you have to remember this one. Cost accounting. Cost accounting. You must have to remember this one. Okay. Now we will come back to next question. The tendency to overrate an employee's performance is known as Povich effect, halo effect, Hawthorne effect, biasness. So what we will say here? Okay, what we will say here? Okay, put your right response in the chat box. The tendency to overrate an employee's performance is known as, okay, what we will say here? Okay, answer would be the halo effect. You all have to remember this one. Okay, now we'll come back to next question. The most important skills to be possessed by a nurse administrator working in a community sector. Okay, in a community sector, okay, suppose a nurse administrator working there. So what will be the most important skill? Okay, he or she will have A option documentation, B option communication, C option coordination, D option organization. Okay, so put your right response in the chat box. Put your right answer in the chat box. Okay, you all have to remember that answer to be the communication. Wherever and whenever you are working, your communication is very, very important. Communication skill is very much important. Very good. Those who have given B option, Shraddha Swai, ओके तन्मय शिवराम, ओके प्रियदर्शनी, ओके जशोवंती, very good. Those who are mentioning communication, their answer is important one. Okay, someone another important thing you must have to remember, POSDCORB. Okay, always this question is asking P for planning, P for planning. Okay, then you will get the, okay, what you will get, then D you will get the directing, okay. C, okay, CO for coordinating, CO for coordinating. You all have to remember this one. Okay, another one you will get, okay, another one you will get O for organizing, okay, O for organizing. You all have to remember this one. S for you will get the staffing, okay, staffing. You all have to remember this one. R for, okay, reporting, okay. B for budgeting. It is very important. Question is asking about this one. Okay, Potts curve. This was coined by, okay, this was coined by okay, Luther Gulick, coined by Luther, Luther, Luther Gulick, Gulick. You all have to remember this one. Okay, very important question. You have learned about it. Now we'll come back to next question. The method of setting formal guidelines before starting a work is known as planning, coordinating, execution, assessment. Okay, mean whatever, mean before starting of any work. Okay, ये formal guidelines is to be set up. Okay, what will say here, whether the planning, okay, thinking before doing is called planning, okay. So what would be the right answer of this question? Answer would be the planning होगा. Okay, हमेशा याद रखो, अगर कोई पूछता है इस what is planning, your answer will be the thinking before doing is called planning. Okay, you all have to remember this one. Very good. Okay, Devidas, Joshavanti, Suprabha. Okay, another one is the, okay, Kavita, Mansi. Okay, very good. Hrusikesh. Okay, those who are mentioning planning, their answer is correct one. Okay, Tanmay has also given the right answer. You all have to remember this. The most important skill required for managing an institution. Suppose you are working anywhere well. Suppose someone will work in the, okay, teaching field. Okay, like a school, nursing school, schools or colleges you can say. Okay, someone is working in clinical field. Clinical mean purely that is, okay, hospital, clinics, nursing home. Okay, so what is the most important skill required for managing an institution? Okay, for managing of institution, what would be the most important skill which will require, whether it was the directing, controlling, inspiring, supervising? So what would be the right answer? What would be the right answer of this question? Okay, most important skill required for managing an institution: direction, B option controlling, C option inspiring, D option supervising. Okay, you must have to remember this one. You must have to important this. Now we'll come back to next question. Will come while planning for a new hospital. The most important factor to keep in mind is the organizational profit, healthcare system, patient comfort, unit facilities and organizational convenience. Okay, someone has planned for new hospital. Okay, what should be the most important factor to keep in mind? माइंड में क्या रखना चाहिए, कौन सा पॉइंट को माइंड में रखना चाहिए जब हॉस्पिटल बनाने के टाइम, प्लानिंग करने के टाइम? ओके, ऑर्गेनाइजेशनल मीन ऑर्गेनाइजेशन का प्रॉफिट को देखना पड़ेगा, और whether we have to focus about healthcare system, whether we have to focus on patient comfort. So what would be the right answer of this question? Here that answer would be the patient comfort. Patient comfort is very very important. Okay, if someone will give all kind of facility, then if patient is feeling comfort himself or herself, then other patient will come back, okay, will come to that particular healthcare institution. So here that answer will be the C option. Very good. Shraddha Swain given the right answer. Okay. Santoshini has also given the right response. Now we'll come back to next question. The group effort required to achieve a common organizational goal. Group effort required to achieve a common organizational goal. Supervision, direction, coordination and organization. Okay. Suppose, for example, take an example of appendectomy procedure. Okay, appendectomy procedure. Okay, removal of appendix is known as, okay, removal of appendix is known as appendectomy procedure. Okay, suppose you have planned for a procedure that is appendectomy. During the time, okay, you need teamwork. You need teamwork. Okay, teamwork means your duty is to, okay, assist the procedure that is appendectomy, so that we can achieve the common organizational goal. Okay, organization का जो goal है, we can easily achieve that goal. Mean patient will get the, okay, or will be free from that appendix, or patient will not have the appendicitis problem after removal of the appendix. Okay, so here that organization has achieved that goal. So what we will say here, that answer will be the C option. Coordination mean the team or in the organization, coordination is very very important. Okay, everyone has to coordinate. Very good, all have given the right response. Suprabha, Ruku, Shraddha, Suprabha, okay, Suprabha, Manjari, then after Husike, Tanmay, Priyadarshini, Mansi, Josovanti, Kavita, Santoshini, all have given the right response. Mona Lisa, Osmita, Tanmay, all have given the right response. The responsibility of the employee that is standardized by an organization is referred as job specification, job analysis, job description, job standardization. Okay. Okay, in organization, okay, mean each employee. Suppose organization I am putting just as a O, this is organization. Here employees are working there. Okay, E for employee. E for, just you have to remember, E for employee. Okay, these are the employee, those are working in the organization. Okay, each employee has a specific job. Okay, specific responsibility. Specific responsibility. Okay, responsibility. What will say here? That is known as, okay, very good. That is known as job description. Okay, as you have already seen in the AIMS nursing officer. Okay, AIMS nursing officer, they have a specific function. Senior nursing officer, they have also specific function. Okay, then another you will get the, okay, assistant nursing superintendent, they have also specific function. Deputy nursing superintendent, they have also specific function. Okay, another one, the NS nursing superintendent, also specific function. Then after, okay, CNO, chief nursing officer, okay, that is also important. Okay, so you have to remember this one. Now we will come back to next question. The type of nursing are assigned that is best suited in an ICU. Functional method, case method, task method, team method. Okay, in the ICU, what should be the nursing assignment should be given? Okay, what should be the nursing assignment that should be given? Okay, that is known as case method. Suppose in an ICU, take an example of ICU. Suppose you are working in ICU. Okay, at the same time you have taken a critically ill patient. Critically ill patient. Okay, having that patient is having COPD. Okay, another one the hypertension. Okay, uncontrolled diabetes mellitus, and the IHD, ischemic heart disease. Okay, Mean you have already taken. Mean actually as per protocol, standard protocol, 1:1 should be given. 1 nurse, 1 patient. That should be given as per the standard ICU protocol. That is known as case method. Now we will come back to next question. Standing order in community health nursing refers to job instruction in PSC. List of prescribed medicine to be kept within nurse during home visit. Job instruction in CHE, therapeutic protocol. Community health nursing refers to what is the standing order in community health nursing. What would be the right answer of this question? You all have to remember this one. Therapeutic protocol. There should be a therapeutic protocol. Which will be a standing order. You must have to remember this one. Have you got it? Now we will come back to next question. The universal precaution include hand washing, gloving, gowning, all of the above. Everyone has to answer this question. What is the universal precaution? What is the universal precaution? Whether it is the hand washing, whether it will be the gloving, whether it will be the gowning, whether it will be the all of the above. Everyone has to respond this question. Because practice makes man perfect. If you are practicing day to day life, definitely you will succeed. This is 100% guarantee. If you are not practicing, mean very less chances, very least chances for the success, because it is always to be taught truth. Hard work will give you the best result. Hard work will give you the best result. So your answer will be the D option. Very good. Now we will come back to next question. Human resource development is closely associated with budgeting, staffing, directing, planning. Human resource development is closely associated with what would be the right answer? Trupti, Mansi, Josovanti, Rinabala, Pragya, Tilottama, Jyoti, Santoshini, Kavita, Hrusikesh, Tanmoyi, Suprabha, Manjari, all have given the right answer. In the earlier question, all have given the right answer. Now it is duty to give your right response in this question. Staffing. Staffing is very, very important. Very good. Very good. Here that answer will be the staffing. You must have to remember this one. You can attend the nursing subject, nursing or medical subject, but it is very difficult to give the right response of the nursing administration, management, health economics, research and statistics if you are not practicing. If you are not reading that thoroughly, you cannot give a single answer of this question. That is why it is necessary to learn the subject, learn the question of the nursing administration, management, nursing research and statistics, health economics. You all have to remember this one. Now we will come back to next question. Which of the following is the best leadership style in a crisis situation where a quick decision making and implementation is required? Democratic, authoritarian, bureaucratic, and the laissez-faire. So what would be the right answer of this question? What would be the right answer of this question? Always we have to remember here. Always you have to remember. Suppose crisis situation. Suppose in a hospital, 20 number of staff nurses are there. Out of that, 6 or 7 number of staff nurses has taken that sick leave. Few have taken that sick leave. Then 1 and 2 has taken that casual leave. 3 and 4 have already taken that. Another different kinds of leaves that is the sick leave, casual leave, another is earned leave. So these are the different kinds of half paid leave also will be there. So during that time, what should be the quick decision making and implementation? So here the answer would be the B, authoritarian. Authoritarian. You all have given the right answer. Laissez-faire is also a type of leadership style. Laissez-faire Fair, okay, Laissez-Faire leadership style is also known as delegative leadership style, also known as, okay, also known as delegative leadership style. You all have to remember this one. Leadership style, you can say. Okay, have you got it? Here what will happen? Here leaders are hands off and now group member to make the decision. Here what will happen? Suppose you are the ward in charge. Suppose you are the ward in charge. Okay. Suppose you are the ward in charge, or you can say matron. Suppose you are matron. Okay. You are allowing your nursing staff. You are allowing your nursing staff to give their, okay, or to make the decision. Okay. That mean whatever they will take, you are agree with them. Okay, whatever your colleagues or whatever your, okay, subordinates are telling you, okay, it is right, okay, they have taken that decision, you are also, okay, agree with them. That is known as Laissez-Faire or delegative leadership style. Have you got it? You must have to remember this one. Okay, here the answer is the B option. All have given right response. In budgeting term, the source of income is known as capitation, revenue, budget, profit source. So what will say? Always you have to remember that Peirce curve. You have to remember this one. You all have to remember this one. This is very, very important. Definitely you will get question from this section. Okay. So what will say here? Here that answer is the revenue. Revenue will be the important. The planned educational experiences provided within job setting is known as in-service education, developmental education, additional education, specialized education. Okay. Take an example of Odisha SSSC nursing officer. Take an example of Odisha SSSC nursing officer. Okay. Nursing officer. Okay. Those who have posted, okay, posted to different CSC, PSC, district headquarter hospital, okay, sub-center, health and wellness center, okay, they are allowing to complete their higher education. Mean those who are second year of PBBSc, those who are second year of MSc, they are allowing to continue their study. Okay, that is known as in-service education. So what will say here? Here the answer is known as in-service education. Or in case of someone has completed his or her GNM, okay, after completion of 5 years, the government will give the NOC, no objection certificate, then they will pursue PBBSc, then they will pursue PBBSc. Okay, that is known as in-service education. That is known as in-service education. Have you got it? Now we'll come back to next question. Which of the following is a method of acknowledging the performance of an employee? Reward, self-assessment, reinforcement, performance appraisal. Suppose you are a matron. Suppose you are a matron of any hospital. Take an example of any hospital. Suppose you are working as a matron. At the same time, someone is doing, suppose in the OT section. Okay, in the OT, okay, 4 staff nurses are there. 4 staff nurses are there. Okay, they are giving their best. They are giving their duty with 100%. Okay, or they are assisting the different cases in, okay, in a comprehensive way, in the different reliable way. Okay, which is magnificent. So you are giving okay, what you are acknowledging their performance. You have done right. Okay, your performance is good. Okay, today is very good. Okay, or the nursing staff of operation theatre is very, very good. So in which way you will acknowledge them? Here performance appraisal. Suppose you have all have given D option. Suppose I will tell you, you have given right answer. If you are not giving any, you have not giving any right answer, then I will tell you, you have not given, okay, right response. I will tell you. Okay. Those who have given the D option, their answer is correct. This is one kind of performance appraisal. Okay, किसी को प्रशंसा करना. Okay, किसी पेशेंट अगर बोल रहा है, पेशेंट को आप बोलेंगे आप अच्छा कर रहे हैं, ऐसे करना चाहिए. Okay, it should be like that. Every day you must have to do. Okay, आप किसी को अगर प्रशंसा करेंगे, एक्नॉलेज करेंगे, तो उसको बोला जाता है परफॉर्मेंस अप्राइजल. यू ऑल हैव टू रिमेंबर दिस वन. A written record related to total number of patients in hospital on daily basis is called census. Anecdote, patient attendance record, OPD record. So put your right response in the chat box. Put your right response in the chat box. Put your right response in the chat box. Here that answer to be the here that answer to be the, of course यहाँ पर आंसर क्या होगा? written record related to total number of patients in hospital on daily basis. Daily basis you are recording, so what will say? Answer will be the patient record होगा. You all have to remember this one. That is not censor. Answer is the C option. You must have to remember this one. Patient attendance record. This is the answer. Have you got it? The professional body that is responsible for controlling and maintenance of standard of nursing in India. In India, one autonomous body is there that will control and maintain the standard of nursing profession. What is the name of that professional body? Whether the TNI, whether the Medical Council of India, whether the Indian Nursing Council, whether All India Federation of Nurses, AIFN का मतलब क्या है? What is the meaning of All India Federation of Nurses? Federation of Nurses. That is the INC. Very good. Kavita, Suprabha, Manjari, Asmita, Monalisa, Santoshini, Hrusikesh, Shraddha, another one, the Mansi. All have given the right answer. Very good. Kavita has also given the right answer. You all have to remember. Latika also given the right answer. Indian Nursing Council. INC का मतलब है Indian Nursing Council. एक्ट कब हुआ था? 1947. You have to remember this one. INC एक्ट कब हुआ था? Indian Nursing Council Act. So your answer will be the 1947. You have to remember this one. Very good. Trupti, simple lifestyle. C, very good. Jyoti, Tanmay, Latika, all have given the right answer. Minimum age required for a candidate to join B.Sc Nursing course. What is the minimum age to enter into the B.Sc Nursing course? Whether it will be the 16 year, whether it will be the 25 year, whether it will be the 18 year, whether it will be the 19 year. So what would be the right answer of this question? In the earlier question, Pragya Ketki also given the right answer. Put your right response of this question. Put your right response of this question. You all have to remember here. That answer would be the answer क्या होगा? Minimum age group is 17 years. Minimum age group is 17 years. हमेशा याद रखना. If you have any doubt, you can visit prospectus or INC guidelines. Where it is clearly written, minimum age group it should be 17 years, not 18. वोट देने का अधिकार है 18 ईयर. अगर शादी मैरिज के लिए 18 मैरिज के लिए 21 ईयर्स याद रखो गर्ल्स के लिए. उसके बाद वोटिंग के लिए 18 ईयर्स. और नर्सिंग पढ़ने के लिए B.Sc नर्सिंग का मिनिमम एज कितना होना चाहिए? 17 ईयर्स. सो यू ऑल हैव टू रिमेंबर दिस वन. नाउ विल कम बैक टू नेक्स्ट क्वेश्चन. The primary purpose of legislation is to protect the hospital authority, nursing staff, patient and staff nurse. Primary purpose of legislation. Primary purpose of legislation. So what would be the right answer? What would be the right answer of this question? So here that answer would be the D option, patient and staff nurse. The patient and staff nurse. You all have to remember this. An answerability of a subordinate to his or superior for performance of the assigned task is known as answerability, responsibility, accountability, appraisal. Suppose you are the boss. For example, you are the principal of any institution. Your subordinate mean the different tutors. They are known as subordinates. They are the subordinate. Tutors are the subordinate. Okay. You have given the task. Task means, okay, you have assigned them tasks regarding, okay, suppose you are telling to one tutor, you have to take the class of the first year. Okay, you are telling to another staff, or that you are telling to another tutor, you have to go to the second year. So in this we are delegating the task to each and every tutor of that nursing institution. So what we will say here? Here that answer to be the accountability, that is known as accountable. Okay, you are the superior, your subordinate is accountable, that to that work. Answer with the C option. So they very good. Mona Lisa also given the right answer. The authority flows from top to bottom. You are the matron in charge. Matron, or you can say nursing superintendent. Now we can say nursing superintendent. Then that will go to the, okay, DNS, deputy nursing superintendent. Then that will flows from ANS. Then that will go to the SNO. Then that will go to the NO. From top is the nursing superintendent. Bottom is the nursing officer. Okay, that means the authority flows from top to bottom is known as span of control, scalar chain, line organization, another the lateral organization. So put your right answer in the chat box. सही आंसर पुट अप करिए. Okay, those who are giving B option, their answer is correct one. Scalar chain. This is known as scalar chain. You have to remember this one. Okay, scalar chain you will say here. Answer will be the scalar chain. You must have to remember this one. This is the answer. Okay, have you got it? That's all for the day. See you tomorrow. Hope you all enjoyed a lot. Thank you very much to all of you. See you tomorrow another interesting session. आपका ख्याल रखिए, परिवार का ख्याल भी जरूर रखिए. ओके, एंड होली अच्छा से मनाइए, पढ़ाई भी करते रहिए. ओके, सो टेक केयर टू ऑल ऑफ यू. गुड नाइट टू ऑल. जय हिंद, जय भारत.